Let's discuss how you can prepare for your surgical consult ahead of time to maximize your experience with your surgeon. The first thing to do when you get a surgical consult is look up who your surgeon is. If it's an academic center, typically surgeons have a little blurb about them, where their training was, what their specialty was. If it's a private practice setting, oftentimes they have an entire website dedicated to their education, their background, their surgical expertise, and their whole team. Figure out if there are certain non-negotiables about your surgeon that you want to change. For example, a lot of my breast reconstruction patients want to see a female. If you've been assigned to a male, you already know that's a non-negotiable, so it's probably worth it to go ahead and reschedule. Other things to look at is what is their board certification is. You want to have a board certified doctor. Once they've passed this test, the next thing to do is to prepare for your surgical consults. Google and WebMD, it's a plus or minus as to whether or not this is helpful to do before your surgical consult. Some of my patients come in having already done a lot of research. I find this especially true for my breast reconstruction patients and for my gender affirmation patients. And while it can be helpful and help a patient figure out a good list of questions to ask their surgeon, finding things out on social media can also lead to a lot of misinformation. So if you do see something on social media or the internet that you want to clarify with your surgeon, that's a good starting point, but I wouldn't take for granted anything that you read on the internet. There's a lot of misinformation out there. The next thing you want to do is to write down your list of questions. Some patients write it in their phone, others bring a journal. That's a really great idea so that you don't forget these important questions in your consult. Studies have shown that patients remember 60 to 80% of what is discussed in a consult visit, and that's because we discuss so much information. It's a very overwhelming time, and this is compounded if you've just had a diagnosis like cancer. So how can you remember the maximum amount of things from your consult? One is bring someone with you if you can. If you can't bring someone with you, see if your surgeon is okay with you FaceTiming a friend or loved one during the consult. Otherwise, take really good notes. The other thing is to ask your surgeon if they have any handouts. I actually send my patients ahead of time some information on breast reconstruction, and I also give them information to go home with. There's frequently asked questions and some general information about the surgery, what to expect. After the consult, when you go home, write down everything you remember, because then you will forget even more as time progresses, and then figure out what questions you still need to ask your surgeon. This is the best way that you can maximize your time with your surgeon and also remember as much information as possible.